physical money and but me do right just so me send you in a minute in Sabakandria and then one Taptap Send.
Yeah, Ebushanfo, we didn't did an Akuma Pachlewa 1. They recommended Taptap Send mama. And that's how for also for baby. Now you basa. Our rating so yeah. Our year A1. So pian load do Taptap Send. That also is can for Taptap.
You're going to do what you're a man, son. You're going to do what you're gala for say. You are going to near this coffee in here. May and friend for the VR, you know, Taptap at the move to what Taptap Send in this street.
The Taptap with the one.
Taptap and one in a
Piao.
Welcome to Property Investor Africa, your gateway to Africa's real estate revolution. Whether you're a developer or seller of prime real estate in Africa, whether you're an investor or buyer hunting for opportunities, or you're a supplier of real estate products or provider of services in the real estate industry in Africa, this is your marketplace. Are you involved in real estate? Are you a seller, a property developer, or a buyer investor? Or you are in the ecosystem of the real estate industry, like mortgage companies, insurance companies, cement manufacturers, electrical suppliers, all of those. If you're one of those, let me introduce to you Property Investor Africa. Hi, my name is Douglas Opon, a multiple award-winning property investor and founder of Property Investor Africa. Being involved in real estate and property, there's a lot of things that I had to go through in order to be able to invest. And a lot of mistakes I made by not being able to find the right people selling the properties, not verifying the sellers, not knowing whether they have title deeds or not, and all of those. And so we have created a revolutionary system that would help you navigate all of that and stop the mistakes. So whether you're a property developer or seller, we are presenting to you pre-qualified investors and buyers on this platform. So no tie kickers, no gimmicks, and no time wasters. And for investors, we have already done your work for you. All the due diligence and research you will do about the property sellers and developers, we've done that, because before any listing is put onto Property Investor Africa, all of those documentation and verification would have taken place by Property Investor Africa's staff. And therefore, we ensure that there is a matchmaking above everything.
Hello. Good evening, everyone. Sorry for keeping you in suspense, but then it's very needed. I'm your host for tonight, Baba Pobi, and I've got my co-host on here. I believe he should be able to turn on his video soon. Yes. Hello, Dr. Blessing.
Hello, Baba, I'm here.
Okay. So we've got Dr. Blessing here as well. And tonight's talk is sponsored by Taptap Send and OT Health Talk. Can you hear me?
Yes, please.
Okay. So tonight's meeting is sponsored by Taptap Send and OT Media TV. And we have our speaker, who is Dr. Akosua. I'm sure quite a few of you know her. And she's going to be talking about autism in the African child. Dr. Blessing, do you have anything to say before Dr. Akosua comes in to talk?
No, please. Let me start in the later one.
Okay. All right. Dr. Akosua.
Hi, everybody. Gosh, it's good to be back.
Hi. It's been a while. It's good to have you back.
Yeah, I've missed you all. I hope you're all doing well.
We're doing well, thank you.
I see a few familiar faces. John Agbe, obviously the two of you, Letty. I've got Despite here. But actually, Despite. I've got Auntie Comfort here. Hello, nice to see you all. And of course, OT Media Princess 82 and the rest. So thank you all for being here on time. I really appreciate it. And I'm glad to be back.
We've got Jibril from
just Jibril.
North London, and we've got Bena Mankwa from Swindon chapter as well here.
I thought the name looked familiar, Ben Amankwa. Jibril, hi Jibril. Hello Ben, thank you for being here. And then we've got Justina Foundation as well. So just Nana, Ufuruwa. The name sounds familiar. I think I've seen you sometime on here, I think. Maybe not a faithful one every week, but I think I've definitely seen you here before. So yeah, thank you all for coming back again.
Okay, Dr. Akos, can we get straight into it?
Yeah, absolutely. So for some reasons, I will need to leave at exactly 9 o'clock. So I'm trying to make this as brief as possible so that we can get to the Q&A sessions. Obviously today, as I say, we're going to talk about autism in African children. Why do I think this topic is important? Because number one, I think our cultural beliefs can shape how we interpret child development, especially from an African point of view, African/Ghanaian point of view. Autism is therefore often underdiagnosed or misdiagnosed in our communities, and many families struggle in silence due to the stigma or lack of information or just not actually knowing what's going on. So I thought it was important to shed some light on what exactly is autism, how can we recognize some of the symptoms and the signs of autism in children, and then what to do once we've recognized some of those signs. Now, again, disclaimer, I do know that there are people usually on the talk show from many parts of the world. So we've got people from Europe, America, but again, having practiced in the UK, when it comes to the diagnosis part and the management part is going to be skewed towards what we do in the UK. But in terms of recognizing the signs of autism and what autism is, that's a global thing. That's not just about, where you are. So, yep, I think it's still going to be important whether you're in the UK or not. So please do stay. Now, the most important question is, number one, what is autism? Okay, so over the years, it's sort of metamorphosed into different things, but now as we understand it, we call it an autism spectrum condition, and that's because it stands on a spectrum. It's not just sort of you've got autism and that's it. There's a lot more to it, and there are almost even 3 parts, and I'll show you an image. Hold on, let me see if I can share my screen. I think I've not done this for such a long time. Has Zoom changed? Oh, there it is. Share my screen. There you go. I'm just gonna quickly share my screen because I want to show you something. If you can you see what I'm showing you?
Yeah.
Okay. So in terms of the spectrum, you can go from anything from high functioning autism to sort of severe autism. Now, what do we mean by that? Again, this will make a lot more sense when I talk about sort of the symptoms of autism. So in terms of the high functioning autism, that's level 1, where you've got the person needs support with things like maybe their social skills or some interpersonal skills, but in terms it's not very noticeable. Aside from maybe some subtle behaviors of having a bit of awkwardness, the person can still go about their daily lives just fine. In fact, some of them can be very, very smart and have very niche interests and be like an expert in a certain topic. So that's why we call high function autism. Just because somebody's smart and just because somebody's a high achiever does not mean that they don't have autism. They might have characteristics or some symptoms of autism, and again I'll come to explain that in a minute. And then you have the learning. Needs a bit of support and can be awkward sometimes, and that it can affect your learning ability a little bit as well. But a lot of these people are still quite high functioning. They're not too bad. They might fall behind in a few subjects, but they can still get along on a little bit in terms of their daily activities. But then you've got the severe autism, which that sort of impairs a person's daily life. So they can also have some severe learning disabilities with that, or not be able to communicate properly, not be able to almost go about their daily lives without needing a bit of support. So essentially, you can be on any part. And again, as I say, even within the high functioning, you've got this bit which is sort of the border with the level 2, and then you've got the very, very high function on the purple side of things. And so somebody can be a level 2 but can be here, which is close to the higher function, or it can be close to the severe autism, but they're still a level 2. So there's such a broad spectrum, and because everybody is different, everybody's experiences are different, everybody's brought up differently, these can also sometimes affect how people present in terms of what they're presenting. So I'll just take a physical snapshot of this image in your head. I'll come back to it. But I'm going to stop sharing my screen. So essentially, that's why autism is so difficult to understand, especially within African communities, because it can literally fall on any part of the spectrum. And you can have a child who's so intelligent, does so well at school, but they can be exhibiting some behaviors. And a lot of the time, within the African communities, we'll say, oh, they're badly behaved, or oh, akolawe umbuadie, or things like that. But actually, it's not that. It's just they're having some behavioral problems, and it's important to spot that. Okay. So yes, I guess in short, what is autism? It's a spectrum disorder. It's usually neurodevelopmental, which means a child's brain develops differently. It affects how they communicate, interact, and experience the world. And it can just affect sort of mostly social aspects of things. What autism is not. And I think, again, I'm going to be talking about what we need to recognize within African communities. Autism is not caused by bad parenting. So again, if you see, again, I think it comes to the idea of when we say somebody's badly behaved. So, where they antitini year, and I say, oh, yeah, pampana dodo or something like that. It's not caused by bad parenting. It's a medical condition. Okay, it's not a curse or a spiritual attack. It's important to understand that. Again, it's a medical condition. I'm going to hammer this home today. I'm going to try to do that. And sometimes some people will say, oh, children will just grow out of it. No, it's not something that they grow out of. Yes, some behavioral changes, which is can be grown out of, but autism, again, is a medical condition. So it's not a spiritual attack, it's not bad parenting, and you cannot grow out of it. You need support with it. It's a lifelong condition. But with the right support, children can usually thrive, okay? What are some of the signs to look out for? So there are 5 main aspects I'm going to talk about. So usually children will exhibit communication differences, social interaction differences, behavior and sensory differences. And that was 4, that wasn't 5. So 4 things: behavior and sensory differences. So when we talk about communication, what do we mean? So I mean things like delayed speech. So you might, if you've got kids at home, maybe your firstborn was talking by, I don't know, 10 months. High achievers. That's really, really high achieving. But let's say a child is talking by the age of 1, and then your second child is not talking even at the age of 2. They're finding speech very difficult, and you're comparing, saying, oh, Kweku was talking by 1. It could be that there's an element of autism here in speech there. Now again, I'm gonna come and hammer on the speech thing because it's different for bilingual families. Okay, if a child is learning Tree at home and they're learning English in school, a lot of the time they'll be flagged as having autism or speech delays, but it's usually not the fact they're bilingual. It is accepted to have speech delays when you're trying to learn 2 languages at once. I'll come to that in a minute, but just for the sakes of this, I'm going to say they're learning 1 language. Let's say they're learning Tree, and that's it. Or for the fact that we're in UK, let's say they're just learning English, and that's the only English language that's spoken at home, spoken at school, but they're still having some delays in their speech, or they are not speaking at all, then that could be a telling sign for autism. They are repeating words, but not really having any meaning to it. Again, at a certain age, that becomes an issue. So again, that's something to look out for. Difficulty understanding instructions. So even simple words like sit down, stop that, no, come here, things like that become difficult. And again, there's a certain age range. I think this is sort of 2.5-ish when they should be doing these things, and they're not doing it. And then the one thing is not responding to their name. And again, if I say not respond to the name, I don't expect a 6-month-old or maybe even a 10-month-old to sometimes respond to their name, But if they're hitting the age of 2.5, and you're calling them and they're just like staring at you blankly, they're not really making that connect that this is my name. That's also a telling sign. So that's where the communication differences come in. Then we've got the social interaction. So they don't like to have eye contact. They prefer to play alone, a bit of a lone ranger. Difficulty making friends at nursery or school, and just doesn't seem to have an interest or share interest in anything. That can be a telling sign as well. Now, don't get me wrong, right? A lot of kids may exhibit some of these behaviors, okay? I always say my son is very antisocial. He doesn't like, but there's something that you can almost tell. So my son likes playing with me, my husband, my sister, like her auntie, the people that he grew up with. But whenever he goes to nursery, he kind of just doesn't like blend, and he doesn't play with other kids. That doesn't mean that he's got difficulty making friends or playing with people, because he's shown that he can play with people. Like when his cousins come around, when his when people that he's familiar, he's playing at home with family members, that means he can play with people. But if he's just antisocial in the way that he just can't connect to people, doesn't have eye contact, and that's to everybody, and then he's also got difficulty making friends at school, then that can be a telling sign sometime, okay? Behavioral sensory differences, so repetitive behavior, so lining toys up in one way, and if the toys are not lined up in a certain way, he gets really aggravated, like, okay, 8 always has to come after 1 if he's lining up his letters, or the color blue always has to come after green, and there's a very particular way that they do stuff. At that age, that can be very telling. Because at that age they usually don't have preferences of things. They're actually usually quite messy and just mess up everything. Even when you want things to be a certain way, you think 1 comes off before 2 and 3 and 4 and 5, and they just put 1 here, 6 here, 7 here, they just mess up everything. So if at that age they're a little bit like, oh, this is going to be like this, and they stick to it and never change that can be a very, very telling sign. Hand flapping has been one people have been called out for. So sort of just doing that. I don't even know why that's, but apparently that's been noted to be among some of the signs and symptoms of people with autism. So we talk about strong routines, but that can also be, so we talk about having like strong preferences for arranging stuff, but strong routines can also be like, for example, if they wake up, they have to wake up, and then the first thing they do is open the window, the second thing they do is brush their teeth, and then they have to go downstairs, and if they wake up and you try to brush their teeth without opening the window, it becomes an issue, and at that age, again, having such a strong preference in terms of routine or routine changes, like we go to swimming every Saturday, and if we don't go swimming, then then there's a whole tantrum day. That's kids throw tantrums shouldn't last more than 5 to 10 minutes. So again, and then and then unusual play-in. So I mean, there are so many things we can go into. I just don't want to. I'm just trying to mention some of the most common things that you might see at home. So when I say unusual playing, so instead of playing with kids when they're around or playing with people, they just like to spin wheels. Or instead of using the car and driving the car, or they'll just turn the car on and be spinning a particular part of it and just fixated on one particular part of things. So that's unusual play, isn't it? What it is important for African families to note, again, because this is predominantly African audience, I'm going to touch on these quite a lot in this. Some behaviors are often dismissed as being they're just stubborn. Boys talk late, and boys get this a lot. So because of that, boys are often misdiagnosed. But oh yeah, boys talk late, else she will grow out of it. He's just stubborn. This again, I think it's worth keeping an eye on kids, knowing what can be normal and what can be abnormal. And if you're ever in doubt or ever worried, just talk to your GP about it, talk to your nursery about it, and talk to the people involved in child's care, because they could often just do an assessment, and if they felt that there was nothing wrong, then there was nothing wrong. But if they felt that something's wrong, then obviously you could pick it up early, but don't brush it off. And that would be sort of my key message today to people here. I know there are probably some adults in here as well who want to know about autism in adults and sort of late diagnosis. I'll touch on that right at the end very briefly, because obviously today's chat is about understanding adult autism in kids, in the African child, but I will touch on the adult just very briefly at the end. The fourth thing I want to talk about sort of cultural differences. In many African communities, autism may be misunderstood for things like, oh, it's a spiritual attack. And then people might end up being punished for it. People might say it's due to poorly ignore it, like I said, saying that it'll be ignored. But this leads to delayed diagnosis, shame and stigma, and then families tend to avoid supportive services. Even I know, like, families who've kind of come to me and said, again, I'll come to the bilingual thing in a minute, but have said, oh, all my kids were tagged as being delayed speech, so I'm just gonna avoid that the service. I'm just not gonna use it, or I'm just gonna avoid my GP because I don't want to. But if you do that, if there's a real problem, we might miss it. If you're tagged as being delayed speech and you go to speech and therapist and they sign you off as not being delayed speech, it doesn't spoil anything. If anything, actually, your child has been checked and now we know that your child is fine. But if you sort of don't engage with those services, you might actually miss a diagnosis, which might be important. So it's important to sort of almost engage and cooperate with the services involved in your child's care, especially nursery things. And I'll give you a personal story myself. But again, in the end, it's a lot of things to talk about in the end, isn't there? So the last thing I sort of want to talk about, or last two things, is sort of getting help. And like I said, this is mainly in the UK. So essentially, if you're concerned, the first thing to do is you talk to your doctor. You can talk to your health visitor, depending on how young your child is, or you talk to your nursery or school teacher. So a lot of the time, these signs and symptoms do tend to show up before the age of 5. A lot of autism symptoms will literally show up under the age of 5. Most misdiagnoses and people, like, in the UK, certainly there are a lot of people being diagnosed with sort of autism and learning disorders when they're older, and that's because these signs have been missed in the past. And that's not blaming anybody. Our understanding of autism is still evolutionizing, and we're still learning new things about what symptoms are, how to diagnose, who to diagnose. But essentially, with the new information that we have, this is what I'm telling you, that we know that most of the signs and symptoms show up before the age of 5, but a lot of the time we just brush it off or ignore it. That's why it's important to talk about the symptoms and not to almost shame or stigmatize and say, they'll grow out of it or all that stuff, okay? So, like I said, nurseries do a great job of picking these things up, and they will literally tell you if they think that your child is showing some signs that they need to investigate. Nurseries cannot diagnose autism, but they can refer and make an autism referral or a send referral, and then your child will be assessed by a specialist, and then if they do have it, they'll be diagnosed at that point. GPs also cannot make a diagnosis of autism. Usually they can say, we think we need to refer, because the autism can be diagnosed by the specialist, which is the send. Or even if a GP does diagnose it, in a way, I suppose they could, but then they wouldn't be the ones to continue the care. It still needs to go to the send specialist. So essentially, if a GP says, I think this child has autism, I'm going to refer them, they'll still have to make the referral, and then that child needs to be treated by the specialist, because it wouldn't be treated by the GPs, or the child wouldn't be under the GPs, if that makes sense. So either way, the GP, the health officer, or the nursery will make a referral. So don't worry. It's not like it's just one person sitting in an office thinking, I think your child's a bit odd, and I think I'm just going to label them as having this issue. But it's literally several professionals will come and say, and again, I guess it's even the wrong term, me using the child is odd. Everybody develops differently. So having autism does not make you odd. It just means that you've got this medical condition. That means you need a little bit extra support. So so essentially that's what you will get when you get diagnosed. There's no sort of I'm being told I've only got 3 minutes left, so I'll do it quickly. There's no sort of medication or anything like that, but it's usually support that you need, support with services, support with behavior, support with social circumstances and things like that. And the very last thing I'm going to talk about essentially is the support that you should be given at home. So if your child is diagnosed with autism, or you realize this, I think for children it is quite quick these days, but in adults, if you're trying to diagnose autism here in the UK, I think the waiting list is about 4 years right now. So if you feel like you've got some of the signs and symptoms we've talked about, and you're on the waiting list to be diagnosed as an adult, these are simple things you can use at home. But again, this is mainly for the children. If you know your child has been made a referral, has been diagnosed with autism, use simple, clear language when you're talking to them. So instead of like long sentences, kofi, kofa, inkosiano, free, numbra, na bayesi, and giving them like 3 instructions at once. Very simple. Kofi, bra. When they come, okay, ko kitchen. We get to the kitchen. Mami nkosia. Just break it down. Very simple languages, very simple things, clear routines. When they wake up, you pray first, you brush your teeth, we go downstairs, we eat breakfast, and get ready, we go to school. Very simple. Not okay, we wake up, we do this, we do that, we do that, we do that. They just need a bit of routine in their lives. So create a clear routine for them. Use visual signs and support. So again, when you're trying to talk to them, instead of using big words, you can be like, you can even have like a picture of a card, or coffee, kitchen, fawe bra, and point to the egg. So instead of big language, using picture cards and easy ways to sort of communicate to help them. Be patient when it comes to communication. Communication in kids already is a struggle, regardless of whether they have autism or not. It's even made more difficult when they do have autism. So be patient. Every child is different. Even when your child does not have autism, there are some children who just talk quickly. Some children are delayed naturally. Just because your child has delayed speech does not mean they have autism, okay? And just because they have autism doesn't mean that they will get delayed speech. So it's not tied together. But it's just important to know you've got to be patient when it comes to these things. Reduce the sensory overload. This is a huge one in African families. Reduce the noise, reduce the crowds, every weekend every weekend you're party or christening, your choir story program, all that kind of stuff. Some people, autism, the sensory overload is the noise, the lights, it's all that stuff, and it can be difficult for them as well. So reducing those things can help kids thrive at home, thrive in communities. Emotional support celebrates small progresses. So even if they make if they say one word, you've been trying to get them to say I don't know, mummy, I need help or something, and they're just able to say mummy, or just able to say help, just that one word. Celebrate it, be like, well done, give them a treat, make them know that that's a good thing, instead of almost being like brushing it off like, oh, you've not done anything. Avoid comparison with other children, especially if they have older siblings. I didn't want to say kweku to me call a potty by themselves. I didn't want to mean potty, that kind of stuff. Avoid it and try and build the child's confidence. So these are ways that you can support. For the parents yourselves, seek community support, because it can be difficult looking after children with autism, again, because you need patience. Hormonal things will kick in, you might get a bit anxious, depression might kick in, so you need support yourself as well. So as much as seeking support for your child, seek support for yourself. Don't isolate yourself, and it's okay to ask for help. I wanted to touch on 3 things in the end. I want to talk about the bilingual children. Bilingual children are usually penned as having speech delays. If your child is bilingual, and if you feel like they're not delayed in speech, then sometimes you can actually, if nurseries will pick up and say, I think your child has a speech and language problem. If you're confident enough, you can say, my child does not have a speech and language problem, and they're bilingual and they speak their language at home. So again, this is why I'll give you my example of mine. But the reason I don't want to, I'm almost contradicting myself, because before I said there's nothing wrong with them being, even if they're penned as having speech and language, nothing wrong with them being tested, because if it comes back negative, and this is why I say if you're confident that they're not, okay? So for example, for myself, my child, we speak Tree at home. So he speaks very good Tree. My like my and he's 3 this month, but he's very good in the Tree language, but he's not very good with English. And when you go to nursery, of course they speak English at nursery. So for his age, he's fallen behind in the English, and his kids in nursery are saying all sorts of things, and your kids in nursery are given what would you say, reading sonnets and things, and he's not really getting that. So they said they were going to make a send referral, but I just wrote them a letter and I said, in my opinion, he's not behind. He's able to say this at home. He's able to do this at home. And from my professional, but that's because I've got the professional input. So if you're a healthcare professional, or like I said, if you're confident, then you can say, no, I'm not doing the referral. But like I say, if you're not confident, or even if you have a few doubts, then that's fine for them to be tested. Just because they're tested doesn't mean that they're tagged, they're diagnosed with a condition that they don't have. They'll be tested before they're diagnosed. So it's not just like, oh, they referred me, so I have it. Okay. Another thing that my son was doing was hand flapping. So there were several things with him, but the hand flapping, I think that comes from me. So whenever I was excited to see him, I would literally be like, oh mommy, oh then mommy, and I was doing that. So he was mirroring that. So whenever he was at school and he was excited, he would do this. So teachers were like, well, he's not speaking, he's got speech delay and his hand flapping, so we're gonna do the referral. That was another thing that he did. And I said my son is antisocial as well, isn't it? Now it already sounds like he's got autism. But this is I guess the reason I'm using this example is I'm saying that some kids might have parts of what I've talked about, doesn't necessarily mean that they have autism. And this is my point. If they're referred, a healthcare professional will assess them. Like, for example, I assessed my son and I was like, he definitely doesn't have it. Yes, he has these parts of things, but he doesn't have the diagnosis. But like I said, you can have these things and not have it. So if you're not a healthcare professional, if you're not confident in it, then the message, you really should get seen by somebody, okay, if they've got some more of this. So yeah, I guess well, I think there was something else I said I'll talk about. I can't remember. Anyway, I guess the Q&A session. If I've missed anything, or if I said I'd say something that I haven't said and somebody's interested in me saying it, then please do ask in the questions. But I think I'll close for now because somebody said we need to do a part 2 of this, because I think in the time frame that we've done it, there's so much to unpack. I'm happy to come back to talk a bit more about it and maybe take a symptom at a time and sort of go through it properly. But so I'll close for now. So the most important thing I want you to remember today is that our children are not less than if they are diagnosed with autism. They are different and they just need support. Just because your child has autism doesn't mean they're going to do badly. Like I said, we have high functioning autism, but even people with severe autism do quite well if they are diagnosed early and then they've got the support in place. Okay, so for our community, what we need to do is educate ourselves, support our families, and advocate for our children, because if we're not able to do this and we're just brushing it under the carpet, then we're doing more harm to them than we are. Because if they're diagnosed later on in life, it would have caused so much more problems. In school, they would have been tagged as having behavioral problems. They would have been put in like lower set classes. They would not have the support they need and just be tagged as, oh, that disruptive child. They'll have bad reports and all those things just because they didn't get the support and help that they need. But if they do have autism and they get the support they need, then people will know actually this is a medical condition and we treat this differently. So we're not going to treat this child like, oh, they're just a problem in the class. We're going to support them to reach the maximum that they can be. So early diagnosis is key, and I just want us to remember this as a community. Thank you for listening.
Thank you very much, Dr. Akos. We will be going for a short commercial break and we'll be back to take questions and answers. Thank you.
Medidi ya nyantachua emre bia mde sika be free Europe akoma abusuafo wo Ghana no me use Taptap Send. Taptap Send, no fee mobile money transfer. Eye easy, eye convenient, eye fast, and sound so ye free. Won't ya she me discover ye mapim. Taptap Send. Entienne also download the Taptap Send app no ewo mobile phone so free. Na fesika komo abusuafo wo Ghana afa na nyina. Taptap Send. Papa no.
Welcome back, everyone. This is a question and answer time. We spoke about autism in African children, and this is a time to ask your questions. Because we don't have too much time on our hands, we're definitely going to ask Dr. Akosua to make time for us for part 2 of this talk, because this is something that we really need to delve more into and understand what autism really is about. Dr. Akosua, I've got a question for you. So you did mention that autism is a health issue. So I would say during pregnancy, are there medications that one can take that can try and reduce the possibility of getting autism?
So that's a very interesting question, and thank you for asking. I think that's something I didn't talk about so much in terms of why do we get autism, or how do we get autism. From the best of my knowledge, and I'm not a specialist here, so I'll have to maybe double check and get back to you, but it's not something that like a learning disability or a brain developmental problem that you can almost acquire during pregnancy or during fetal development. Autism is not something that happens in that way, or that I understand. Now, I remember that there have been a lot of people saying things like vaccines cause autism, or this causes autism, and that none of that has been proven. And none of those are known to be facts. To the best of my knowledge and to the best of the medical knowledge that we have at the moment, there's no such thing as vaccines causing autism or any medications causing autism or anything like that. Obviously, during pregnancy, the best thing you can do for your child's brain development to take your folic acid, take your supplements, and that will help with brain development. But in terms of doing anything particular to avoid autism, what I can do is give the answer for the best brain development. Autism it can be genetic, okay? So, it tends to run in families. If somebody in the family has had autism before, most likely people down the line will have it as well. So in a way, it's almost like saying, if I'm pregnant, if you're already pregnant, is there anything I can do to not let my child get sickle cell? If you know you've got the sickle cell gene, it's not something that you can really do once they've got it, but you can help in terms of with brain development. And I think that's the best answer I can give you today.
Okay, thank you so much. And I'm sure when we come back to the part 2, if there's anything else that you would let us know.
If any updates, I'll let you know.
Thank you. And the second question is, so again, when it comes to autism, do you think letting a child be more involved in like family activities, like a big family setting and all of that, can help with their speech and the way they do their things? Maybe it can shape how the autism might get worse or might not get worse. Do you think it's any good?
Absolutely. And I think it depends. Okay. So like I said, in terms of autism, there can be different symptoms and signs. If a child has been diagnosed with autism but does not have those sensory issues and does not have difficulties with loud sounds and things, then of course letting them go around bigger families and things. The only problem there is that there might be a lot of pressure. If a family understands, for example, if you've got like I've got a big family, so you've got a family of like 10, and you've got they're always coming around and they're talking, and they all understand that this child has this issue, so we're all going to help support the child, but we're not going to put pressure on the child, okay? Because what tends to happen is sometimes one auntie from someone trying some sort of forceful nature or just not really, and me back you did 3 months and all that stuff, and that actually does not build confidence in the child. So I think number one, if everybody's on the same page and they understand that this is the situation, you can talk to the child but don't force the child, then it's good to have them around that sort of circumstances. But if a child is also not comfortable to be around big crowds, then definitely don't take them, because it's just going to make their symptoms worse. Okay.
All right, thank you. So I'm going to ask a few questions from the chat section. So I'll start from the bottom. One from Ato says, can you determine it during pregnancy if your child will be autistic?
Can you determine from during pregnancy? No. So again, no, it's not something that we can test for. So unlike Down syndrome or other conditions that we can test for, you can't really test for that. So unfortunately.
So it's 50-50. You're just going in blind. You never
Yeah.
know what's going to happen. Okay,
Pretty
that's
much, yeah.
scary. Dr. Blessing, I'll come to you in a minute. The next question is, how can caregivers take care of their own well-being while supporting their child?
So I think I mentioned this right at the end, but I think it's important to go through it again, so I'll say it again. I think there were three main things that I said we needed to do in terms of seeking community support. So number one, remember I talked about tend to stigmatize these things, and we tend to almost shame it and say we don't talk about this. Oh, we dey and bosso cry. A call for you one kason to do 5 way and bosso cry. That families talk about these things. Because if you talk about it, then it's like we know that there's a trend in the family. Okay, oh, grandpa Fori had it, uncle Opoku had it. Then you know, okay, there's something that runs in the family here. So we're more tuned to understanding that that's going to happen. Okay, or that might happen. What was the question?
How can caregivers take care of their
support themselves? Yeah.
well-being?
And so once we've created an environment where we're okay to talk about it, then we can seek more support. So again, going to your GP, seeking community support from sort of charities that offer help with taking care of the child, but mental health for you as well. Because like I said, raising children alone can cause a lot of mental health problems and a lot of physical abandonment problems. But if you've got that on top of it, then you can really, really start to feel a certain type of way. So you need to look after your mental health, you need to look after your physical health, and you need to get support. And the places you're going to get support from is the community, your GP, health visitors, charities, you name it, okay? And just don't be afraid to ask for help is what I will say, because by talking about it, by opening up to someone, you never know. Somebody's just written a message here saying she's heard that 2 children have recovered from it after taking a supplement. I'll come to answer that question in a minute, because it's a question that's come to my inbox. So you can ask your question, but I've got like 2 questions in mind. So, but I'll come to talk about that. But my point is, even though there is no cure for it that we know, there's no cure for autism, and it's just supportive management, like I said before. But somebody might have done something that really helped their child. So if you talk about it, you can find a community, and then that community can find a community, and then that community can actually help you, and you can actually help yourself and your children too.